you rested your knee for 2 weeks and the pain went away. And so you wear your running shoes, you laced up and ran. About 2 kilometers, 3 kilometers in, the pain came back with a vengeance. Same knee, same spot, but worse than before. And now you're thinking, what's wrong with my knee? What's wrong with me? Right? So if that's you, stay with me. Today I'm going to talk about runner's knee. It's probably the opposite of everything you've been told before. So first, let's talk about runner's knee. The clinical term is kind of long. It's called patellofemoral pain syndrome, right? It's got to do with your patella, it's got to do with your femur, and there's pain, right? And it's one of the most common knee conditions that our knee physios treat. So, okay, it doesn't happen in just runner's knee, even though the name is called runner's knee, right? It's kind of like tennis elbow. You think that only people who play tennis get tennis elbow, but no. Runner's knee doesn't happen just to runners. It happens in cyclists. It happens to people who squat, people who are working at the desk workers who suddenly decide to train for a small marathon of 10 click, right? The people who also take a lot of stairs also can get runner's knee. It's pain around. You see, this is the knee, right? So this is the front of knee. So around your knee or behind your kneecap, behind, right? It's usually worse when you're going down the stairs than up the stairs. So I had it before, so actually, and it flares up if you do squats. And here's one thing that surprises many people, right? Sometimes it can hurt when you sit still for a long time. Okay, I'm going to repeat that, okay? Runner's knee can also hurt your knee. Your knee can feel painful even when you sit for a long time. So imagine that you are when you see a movie, you're taking a long haul flight, maybe you sit down a full day at your desk. So when you stand up, you feel your knee stiff, aching, and even painful. Even if you didn't run, even if you didn't climb stairs, right? So even if you didn't move, your runner's knee can feel painful for your knee. And that's not just soreness, okay? That's your body really sending your brain, sending you a signal, right? But most people, they think it's okay. They just, okay, I'm just gonna sit down, I'm gonna rest. And that's exactly where the problem begins. So the mistake that everyone typically makes, right, with runner's knee, okay? The most dangerous thing about runner's knee isn't just the pain, okay? It's that the pain is manageable. So it's not crazy painful enough for you to say, I'm going to see a doctor today, I want to go A&E today, I must get it done. The pain is there and it's manageable. So you think to yourself, oh, it's just kind of mild. Kind of like what I've shared in my last few videos. People just ignore it. The pain doesn't stop you completely. You still can walk. In fact, you maybe still can jog and run, right? At least for a while, right? So most people do exactly what feels logical, right? They just do pain law. Then when pain, they cut back, they scale back, or they rest. And then when less pain, then they repeat, they go back to activity. When it feels okay, then when pain, then they rest. And then they repeat this cycle. 1 month, 2 months, 3 months, 6 months, 1 year, 2 years. But what they don't realize is that underneath that, this manageable, mild pain, moderate pain at best, your cartilage is being loaded incorrectly. Every single time they return to activity without fixing the root cause. And here's what makes this runner's knee serious. Cartilage is whitish in color, means there's very poor or zero blood supply to it. There's limited blood supply to it. Blood is nutritious, it heals and repairs and fixes things. So when there's no blood supply, it tends to get injured again and again or heal very slowly. So it's a terrible combination. Heal slowly, high risk of re-injury, and then they both reinforce in a vicious cycle, right? Your cartilage doesn't heal the way our muscle heals. Our muscle is full of red blood, so it heals very quickly with any injuries. Early cartilage stress doesn't always show up in an MRI, and by the time the scans look bad, the damage is already done. So if I'm talking about a person that you know, or maybe it may be you, if you're in that rest, run, pain stage cycle right now, I want you to hear this clearly from me. Your clock is ticking, time is running. So it's something that you shouldn't delay anymore, especially if you have pain in your knee more than 10 days, more than 1 month. It's actually 10 days is my cutoff point. If it doesn't get better in 10 days, it must go back to normal in 10 days. If not, see a physio, see a hand therapist. Now, what's the real cause of runner's knee? And why you've been treated wrongly, or why you've been treating your runner's knee wrongly? Okay, here's what people are seldom or never told. So runner's knee is almost never purely or only a knee problem. Our kneecap sits in a groove. There's a groove here, you can see, right? I cannot really show you. It's a groove. When you move, your patella is supposed to track smoothly through that groove. But in most runner's knee patients, right, the kneecap is being pulled slightly off track. So instead of being centered, it goes off a little bit, right? This causes uneven pressure, unnecessary friction, and over time, this pressure, friction, rinse and repeat, creates pain. So the question is that, what is pulling my kneecap off track, right? Why is it off track in the first place, right? So in the majority of cases, our physios assess and treat is typically weak hip muscles, specifically the glutes, which is your butt muscles, and your hip external rotators. So your hip, it can rotate externally, right? It's weak. When your glute muscles and your hip external rotators are weak, what happens is that your thigh rotates internally, inward slightly during movement. So this very small inward rotation changes how your kneecap tracks down the track. So yes, your hip is higher up, your kneecap is further down, but because of the way there's a slight change in slight internal rotation of your hip joint that causes your kneecap to also track slightly off. So the key word is this: your knee is the victim, right? The hip further up is the culprit, is the problem. So our physios for the knee also look at foot mechanics. Is there overpronation, where the foot rolls inwards more than neutral, right? And this create a chain reactions that also travel up the knee. So again, your knee could be a double victim from the hip and also potentially from your foot and ankle, right? That's number 2. Okay, then number 3, there's also a training load. See how fast do you ramp up your running? What surface do you run on? What shoes do you wear? So this is why people who only see the knee as the knee and runner's knee as only a knee problem, they only do quad stretches, eyes, but they keep coming back with the same problem again and again. You're treating the victim, you're treating the symptom, but you're not treating the core problem, not treating the core systemic issue. So here in Phoenix Rehab, physio in hand, right? So when someone comes to us with runner's knee, we don't just look at the knee. Yes, we look at the knee first. That's the ground zero, right? Or that's the victim, right? But we have to go look the full chain. We have to look upward, we have to look downwards, upward at the hip and the glutes, right? We go downwards, foot and ankle. Is it a hip strength issue? Is it a foot position issue? Is it movement patterns under your load, under dynamic movement, right? Because if our knee physiotherapists do not find the actual core problems, core drivers, we are only treating it superficially or symptomatically, and that's not acceptable. We will treat the pain first, but we always must zoom in and treat the core problem. If not, it will be a recurring problem issue. So what happens if you keep waiting and you keep repeating the cycle of pain and rest? So I want to be direct. So most runners' knee respond really well to knee physiotherapy. Okay, the right knee rehab program targeting the actual cause usually gets people back to full activity, no problems. We see this routine for us, we see it regularly, but that's a window of time, right? When someone comes in early, complies and go with the treatment regularly, when the cartilage is still intact and the mechanics are just off, we have a lot to work with and we have time and we can work quickly. Your your recovery is faster when you come in early. The prognosis is wonderful, excellent, and we can get you back to running up and down hills, wherever you want. Not just pain-free, we'll get you running properly, long distance. But what happens when somebody with runner's knee has been ignoring it or putting it off for 12, 18, 24 months of that rest run cycle? The picture can be quite different. Your cartilage for the knee has been under a normal load for a long time. We can, of course, our knee physio can help significantly still, but the ceiling of recovery, instead of 100%, it may drop a little depending on how severe it's been. And the longer your timeline of cartilage damage because it's been not treated for a long time, the ceiling drops more and more over time. I don't like to share this kind of things because it sounds very scary and alarming, but this is data. I am saying it because we have assessed and treat patients who have come in early, who came in a bit late, and who came in very late. And they always say, though these people who come in late or medium, they always say they wish they came in earlier, or they wish that someone told them to come in earlier. So if your knee has been painful for more than 10 days, for more than 1 month, don't negotiate with it, don't ignore it, don't think that, oh, a rest is fine. Please consider listening to your knee. Come in. If it's really mild, we see you a couple of sessions, then you're out the door, you're fine already. But if you catch something that and can prevent something that's really big that can impact you long term, then it's a good thing to prevent such a damage, isn't it? Right? So what to expect for your runner's knee or knee pain at Phoenix Rehab? Right? So when you come to us with runner's knee, here's what the process looks like. First, and definitely what's required, is a thorough assessment. Not just the knee, we need to see how you move, we got to look at your hip strength, we've got to look at ankle mobility, foot alignment, we ask about your training history, your goals, your lifestyle, and then we will palpate and we'll tell you exactly what's causing and driving your pain. You're not going to get a vague diagnosis, you're going to get a specific explanation that you can understand and that you can work with. Right? From there, our knee physiotherapists will build a knee rehab program around your knee, around your life. Whether you're training, whether you want to just go back from knee pain to no knee pain to strength, or you want to train an ace that run, be it a 21 click run, a full run, you want to go 100 click, okay, or maybe you want to go back to just recreational jogging with your loved one or your kids or your pets, right? Or you just want to go up and down stairs without pain. Okay, the goal and the program are yours. We are just here to support you and help you keep going, keep running again without pain, right? So, and we won't just say, okay, go home, do your own exercises and just send you off. We will assess you properly, we will do the exercises with you, we will course correct as we see live how you are coping as you do the exercise right in front of us. You do on your own is one thing, but having somebody with a trained eye to know what we are supposed to look out for a runner's knee is very important. We're going to track your progress, we will adjust, and we will make sure that the underlying cause is actually being corrected. Not just managed, not just ignored, right? So our sports and musculoskeletal physiotherapists work in musculoskeletal system, work in sports rehab, work in orthopedic injuries and post-surgery conditions every day. Runner's knee is something that we see, assess, treat with a level of depth that most general physios cannot match now. So I'm confident to share that without being overconfident. So to round it off, so if you're dealing with knee pain, be it between 2 weeks, 2 months or 2 years, the first step is always understanding, knowing what you're dealing with. If you know what you're dealing with, that's half the battle won already, right? So WhatsApp us at 88001830 and we'll set up an assessment with one of our knee physios. We'll tell you exactly what's happening, what's driving your knee pain or your runner's knee, and what a realistic recovery looks like for you. Please don't spend another 6 months in a rest, run, pain cycle. It's not going to help you, right? It's not going to work. It's been more than 10 days, more than 2 months, and it's not going to work because it's a vicious cycle. So come and find out what's going on. So this is Nigel here from Phoenix Physio in Hand. That's all I have for you today. Take care. Let's run well. Bye.